Registered nurse Amy Halverson is getting ready for her final shift at Sydney's Westmead Hospital. 2 years into the pandemic, her dream job has become a nightmare.
The shortages are just crippling. Nurses are going to work with the anxiety that they're going to be taking on double the workload. It's hard to see your colleagues breaking down, crying, just feeling helpless.
The pressures of the pandemic have been unrelenting, but she says nurses have felt unable to speak out.
We aren't able to go out and strike. We aren't able, like the teachers, like the trains, because if we walk out, people will die.
As her mental health declined, she felt she had no option but to resign.
Straw that broke the camel's back, you could say, was this new surge and seeing the state of the healthcare system, and I just don't believe there's any sort of end in sight.
The ABC has been contacted by a number of doctors and nurses who tell a similar story. After 2 years of COVID, they're burnt out and exhausted. And with no end in sight to the stresses and strains on the health system, the danger is that many more highly skilled professionals will decide to walk away.
We see that from the research from past pandemics, actually, that there's increased attrition from the workforce. It's understandable that people have sort of met how much that they can cope with.
New South Wales Health says there's no evidence of increased staff turnover since the start of the pandemic, and that staff have support available to them around the clock. Amy Halverson set her sights on becoming a nurse as a teenager after watching her mother go through breast cancer. The decision to leave the job she once loved has not been easy.
I feel like a massive weight has been lifted off my shoulders, but also really sad. I knew nursing would be something that would make my family so proud.
Leaving for the night shift one final time. Ursula Malone, ABC News, Sydney.